I'm Dr. Michel Kazatchkine. I'm the former executive director of the Global Fund to fight AIDS, TB and malaria, and now just recently appointed as the UN Secretary General's Special Envoy on AIDS for Eastern Europe and Central Asia.
You have a long experience in working in the global response to HIV and AIDS, and here there is talk about ending AIDS. What is your perspective?
My perspective is that there's still a long way to go, but I do agree that with the science we have, and with the feasibility that the world has demonstrated to achieve things that 10 years ago many of us wouldn't think could be achievable, I believe this is the right slogan. Yes, I believe that we can turn the tide. I believe that one day we can end AIDS. But we are also in difficult times. We're facing a major economic and financial crisis. We also see that although the global movement and the global trend is towards significantly increased access to treatment, decrease in mortality, decrease in new infections, there are regions and there are groups of people that do not fit the model somehow. And I'm very worried about an increasing gap between those who do well and those who still haven't really made significant progress.
This gap, is this like a new development? I
believe it is more striking at this particular conference than perhaps it was before, although we already knew at the last conference, and we knew in Vienna, of course, and we knew in Mexico that, for example, the Eastern European and Central Asian region or North Africa and Middle East have levels of coverage with antiretroviral treatment that are significantly lower, but that gap is increasing. We knew that people who use drugs don't receive somehow the attention and the commitment that they should when, you know, 1/3 of at least of all infections occurring outside Saharan Africa are actually occurring among people who use drugs. We know that inappropriate policies in many countries of the world, we know that prohibition law enforcement, we know that criminalization of use, you know, until they're addressed, will actually only contribute to increase that gap. And we will not end AIDS if we do not also address those countries, those regions, those populations that are lagging behind.
What is happening right now in Russia, Eastern Europe, Central Asia with the epidemic? Where is it going?
It is growing, it is still growing, and it's the region of the world where it is still growing. It's growing fast. It's grown from a concentrated epidemic to now a generalized epidemic. As the epidemic we see becomes feminized and involving more women, and we see very little progress in access. The latest figures released at this conference is that whereas the world has reached somewhere around 55% global coverage with antiretroviral treatment, in that particular region it's 23%, which is somewhere unacceptable. And if you look very specifically, for example, at the Russian Federation statistics, you see that whereas the people who use drugs represent about 60 or 70% of the accumulated infections recorded in the Russian Federation, only a little less than 20% of the people who use drugs who are in need of treatment actually access treatment. So these are really issues that we need, and they're hugely difficult, because this is about politics, this is about culture, this is about society. But I'm seeing at this conference both these gaps somehow receiving more attention, be it MSMs, sex workers, people who use drugs. But I'm also encouraged by seeing a lot of research now starting on about how to reach those difficult populations. This morning's plenary, which was about prevention and saying, first identify the population, then identify the interventions that work and that fit best that particular population. Get rid of the interventions that you know do not work. I think these are key slogans for the coming years.
The political leadership in Russia and Eastern Europe and Central Asia, how are they developing in order to approach and confront the epidemic?
Well, they're still on their line. They're still on their line, and for example, harm reduction programs are basically almost inexistent. Methadone is illegal in the Russian Federation. The programs that have been developed at very small scale in neighboring countries are at risk. When it comes to needle exchange, there's an average of 30 or so needles per drug user per year that are distributed in that region. So we're talking about really being totally off scale. Now, I also know the authorities are actually, conscious of the problem. I'm somehow frustrated that the medical and scientific community is not mobilizing more. I have been meeting often with Russian authorities, and they would say, methadone, we hear you, but our narcologists and our academy is saying that this may not be the right approach. So we are a sovereign government and we're taking our decisions. And I just can't understand how the scientific and medical community can be so blind to evidence. But shifting from Russia to neighboring Ukraine, I was there a few months ago and I met with the Prime Minister and his cabinet, and I felt that they were sort of torn between the challenges they see in their own country and with the internal politics and the public opinion when it would come to shift policies, and really acknowledging that more than somewhere around 1.2, 1.4% of the population is now infected with HIV, and that they're experiencing the highest rate of growth of the epidemic in the region. So I'm hopeful, and that will be my new job now. I'm hopeful that bringing the evidence and going into maybe a bit of quiet diplomacy, we could change the trend.
How is it with stigma and discrimination?
Terrible, terrible. And that's not new news. If you look at the history of Russia, Russia is an amazing country with extraordinary intellectual power, creativity, art, science, poetry, literature, music, compassion, humanism, and yet Russia is also a tough, brutal, violent, homophobic, xenophobic society. Now, we're talking about the Russian Federation. I just don't want, in that particular interview, to see Russia as an exception. Discrimination and stigma remain particularly linked to ignorance, and insufficient information are a feature of the region. But then, if you listen to this conference, it's still predominant in so many countries of the world. It's still true in my own country, France. If you look at the last elections, it is also true in your Nordic countries, of course. So let's not, I don't want to sound as as an exception, but you know, unless we address this, unless we have more tolerance and more understanding, and unless we can build a societal collective consensus where public health and the good of people for their health is the primary driver, we will not be able to shift the policies.
Are you optimistic?
Yes. I think sometime this will change and the trend will reverse in that region. It will not be forever that harm reduction is not present in the region. When that will happen, I don't know.
Is it necessary to fight stigma and discrimination in order to end AIDS?
It is absolutely necessary. Fighting for human rights, you know, no prevention intervention will actually be effective and implementable at large scale unless the fight for human rights continues as a priority.